0.
Nishant, today is your presentation on azidothymidine. Have you prepared for it?
Yes, ma'am, I have prepared for it.
Okay, present it in the classroom.
Yes, ma'am.
First of all, we know about azidothymidine. Zidovudine, ZDV, also known as azidothymidine AZT, is an antiretroviral medication used to prevent and treat HIV/AIDS. It is generally recommended for use with other antiretrovirals. It may be used to prevent mother-to-child spread during birth or after a needlistic injury or other potential exposure. It is sold both by itself and together as lamivudine, zidovudine and abacavir, lamivudine, zidovudine. It can be used by mouth or by slow injection into a vein. Common side effects include headaches, fever, and nausea. Serious side effects include liver problems, muscle damage, and high blood lactate levels. It is commonly used in pregnancy and appears to be safe for the baby. ZDV is of the nucleoside analog reverse transcriptase inhibitor NRTI class. It works by inhibiting the enzyme reverse transcriptase that HIV uses to make DNA and therefore decreases replication of the virus. Zidovudine was first described in 1964. It was approved in the United States in 1987 and was the first treatment for HIV. It is on the World Health Organization's list of essential medicines, the safest and most effective medicines needed in a health system. It is available as a generic medication. Ma'am, I want to show a video regarding working mechanism of azidothymidine.
Yeah, sure.
Hi everyone. Today in this video, let us discuss about the zidovudine. How this drug acts as an anti-HIV agent, what is the mechanism, side effects, drug interactions and contraindications of this anti-HIV agent. Zidovudine is one of the drugs which is commonly known as anti-retroviral agent because this drug is going to decrease the HIV infection, which is a retrovirus. So that's why this drug is called as anti-retroviral. And even the mechanism of the drug is related to the inhibition on the reverse transcriptase enzyme activity. At the same time, this drug can also be used to prevent the HIV transmission from mother to baby. So from the maternal to the neonatal, HIV transmission can be prevented by zidovudine. So zidovudine is one of the drugs which is having some structural similarity with the nucleosides and it is going to inhibit the reverse transcriptase enzyme. That's why this drug belongs to the category of NRTI, nucleoside reverse transcriptase inhibitors. So many drugs are there in the NRTIs, but among them zidovudine is one of the drugs which is used to prevent the mother to baby HIV transmission, as well as it is also used for the treatment of HIV infection along with the other drugs. So today in this video, let us see how this drug acts as NRTI, nucleoside reverse transcriptase inhibitor. First of all, let us see the structure of zidovudine. So this is the simple structure of zidovudine, and here we can observe a nucleic acid base. So here this is the heterocyclic ring system which is made up of pyrimidine. So zidovudine is a pyrimidine analog, and if we carefully observe, this is nothing but the thymine. So thymine is present as a nucleic acid base which is attached with the sugar moiety, so it becomes a thymidine. But it is a modified structure of the thymidine where one of the OH group is going to be replaced with the azido group with 3 nitrogens. That's why zidovudine is indicated with one of the label AZT. So this AZT indicates it is a azidothymidine. Now we can easily observe that zidovudine is a analog of thymidine, so it can compete with the nucleosides within the host cells, as well as it inhibits the reverse transcriptase enzyme activity. That's why it is classified as NRTI, nucleoside reverse transcriptase inhibitor. But in order to show its action, initially this drug should be activated into triphosphate form. So now if we see the activation, this is the structure of zidovudine and it undergoes the phosphorylation such that it is going to form a product zidovudine triphosphate. So zidovudine triphosphate is the active form of this drug which is then going to inhibit the reverse transcriptase enzyme activity. Now let us see how this drug acts in the HIV infection. So HIV cell is composed of the different components and it is having the outer lipophilic core which is attached with the glycoproteins. Particularly GP41 is present on the outer coat which is responsible for the attachment of this viral cell into the host cell. And on the host cells, the CD4 cells are expressed along with the CCR5 co-receptors. Now this viral cell can bind to the CD4 cells which is responsible for the stimulation and entry of this viral cell into the host cell. So after binding to these CD4 cells, the viral cell can enter and it can release the components into the host cell. So here one of the important viral component is the reverse transcriptase enzyme. This enzyme is going to produce a reverse transcription where it converts a viral RNA into the viral DNA. So in order to prepare a copy of DNA from RNA, it requires the nucleosides. Now these nucleosides are undergoing the phosphorylation such that they are going to form in a triphosphate form and they can bind to this reverse transcriptase enzyme. In this way, every nucleoside can interact with the reverse transcriptase enzyme, thereby they can prepare a slowly growing DNA copy. So from the viral RNA, this reverse transcriptase can prepare the viral DNA copy. In this way, reverse transcriptase can prepare the viral DNA copy from the viral RNA. But here Azidothymidine is one of the nucleoside reverse transcriptase inhibitor, which is again converted into its triphosphate form. And within the triphosphate form, now this drug again bind to the reverse transcriptase enzyme where the other nucleosides are going to bind, such that it is going to prevent the attachment of the viral nucleosides to this reverse transcriptase enzyme. In this way, Azidothymidine can inhibit the activity of the reverse transcriptase enzyme, thereby it can prevent the conversion of the viral RNA to the viral DNA. And since it is going to compete with the nucleoside triphosphates, Azidothymidine is a competitive enzyme inhibitor and it is a NRTI, nucleoside reverse transcriptase inhibitor. What are the side effects? Azidothymidine is one of the NRTI which produce so many types of side effects, and among them headache, nausea and vomiting, anorexia, loss of appetite, and constipation are few of the important side effects. And apart from these, it can also produce few of the other side effects like malaise, a lack of energy. All these are the common side effects produced by Azidothymidine. On the other hand, few of the side effects of the Azidothymidine are more important clinically. So Azidothymidine can also produce the hemodynamic changes. It can produce the anemia and neutropenia. These two side effects are more pronounced when this Azidothymidine is used for a prolonged period. That's why along with the Azidothymidine, few of the other supplements are given in order to prevent the anemia and neutropenia. Anemia can be controlled by apoitin. Apoitin is one of a erythropoietin which can control the anemia. Similarly, filgrastim. Filgrastim is a granulocyte colony stimulating factor which can control the neutropenia by increasing the neutrogenesis. So these are the two important side effects, anemia and neutropenia, that are produced by Azidothymidine. And apart from this, another important side effect is the lactic acidosis. This lactic acidosis is because of the accumulation of the lactic acid, and this is more pronounced with the Azidothymidine producing the hepatomegaly. Hepatomegaly is the enlargement of the liver that can be observed with the treatment with Azidothymidine. And another important effect on the liver is the steatosis. This is one of the conditions of fatty deposition within the liver resulting in the fatty liver. So both of these conditions can further increase the lactic acidosis, which should be carefully monitored. What are the precautions? So already we have seen one of the important side effects is the lactic acidosis. So this is again to be taken as a precaution. So if any patient already having a risk for producing the lactic acidosis, this drug should be carefully given. Particularly other antiretroviral agents can also produce a lactic acidosis. So in such conditions, Azidothymidine should be carefully given. Similarly, another precaution is the myopathy. Azidothymidine can increase the muscle pain as well as the muscle inflammation. So if any patient already having the muscle disorders, this drug should be carefully given. And another one is a bone marrow depression. Many of the anti-cancer agents can produce a bone marrow depression. Similarly, few of the other viral agents can also produce a bone marrow depression. So when the drugs are going to produce a bone marrow depression, they can decrease the erythropoiesis as well as neutrogenesis. So it can lead to the anemia as well as neutropenia, which are further increased by the Azidothymidine. So if any patient are having the bone marrow depression or using the cytotoxic drugs, this drug should be carefully given. Similarly, accumulation of the body fat. This drug may produce an unequal distribution of the fat. Sometimes the fat may be deposited on the backside, resulting in the buffalo humps. So care should be taken to check any symptoms of fatty deposition. And ribavirin. Ribavirin is one of antiviral agent particularly used to treat the hepatitis C infection. And this drug can inhibit the phosphorylation of the Azidothymidine, and we know that Azidothymidine is going to be phosphorylated into triphosphate form where it is going to inhibit the reverse transcriptase enzyme. So this phosphorylation is an important step in the activation of the Azidothymidine, which can be inhibited by ribavirin. So when the ribavirin is given along with the Azidothymidine, the action of the Azidothymidine can be reduced, which may result in the failure of treatment. So again, care should be taken whenever Azidothymidine is given along with the ribavirin. What are the contraindications? Azidothymidine is one of the drugs which can produce few of the hypersensitive reactions. Sometimes in the patients can produce the severe anaphylaxis as well as Stevens-Johnson syndrome, which is a fatal hypersensitive reaction. In such conditions, Azidothymidine is contraindicated. Drug interactions. One of the drugs is the stavudine, which is somewhat similar to the Azidothymidine. You can observe both are having the similar suffix. Stavudine is a thymidine analog, whereas Azidothymidine is again a thymidine analog. So both of these drugs are NRTIs. So when both of these drugs are given simultaneously, there may be a competition of these two drugs for phosphorylating enzymes. Thereby each drug can produce the antagonism on the other drug, and they can also produce some cross resistance. Because of these two limitations, stavudine and Azidothymidine should not be combined. Similarly, another drug interaction is with the doxorubicin. Doxorubicin is one of a anthracycline antibiotic which is used to treat the cancer. And again, this drug can produce the inhibitory effect on the Azidothymidine, and it can produce an antagonism on the actions of the Azidothymidine. Thereby, this combination should be avoided. Similar other drugs like the ganciclovir, ribavirin, and interferons, all these drugs can produce a bone marrow depression, and this can result in the anemia as well as neutropenia. Azidothymidine can further increase anemia and neutropenia. So with these drugs, Azidothymidine should be carefully given. How it is given? This drug is given as a tablet form at a dose of 300 mg. Otherwise, it can be available as a capsule form at different doses like 100 mg as well as 250 mg. And it is also available as a syrup at a dose of 50 mg per 5 ml, as well as an injectable form it is available. And the dose of this Azidothymidine depends on the type of condition. For treatment of HIV infection, it can be given at 300 mg twice daily in combination with the other drugs. But in case of prevention of HIV infection from mother to baby, the dose of the Azidothymidine depends on the stage where it is going to be used, whether it is going to be used prepartum or intrapartum or postpartum. So that's about the Azidothymidine. Azidothymidine is one of a nucleoside reverse transcriptase inhibitor, which is a thymidine analog with an azido group. So that's why it is called as azidothymidine. And because of the structural similarity with the nucleosides, it can compete with the nucleosides for phosphorylation, and it is going to be converted into triphosphate form. Then it can compete with the nucleoside triphosphates for binding to the reverse transcriptase enzyme. And on binding to the reverse transcriptase enzyme, it can inhibit the conversion of the viral RNA to the viral DNA. Thereby it inhibits the HIV cell replication. And this drug mainly produces few of the common side effects like the headache, nausea and vomiting. But important side effects are the lactic acidosis, anemia and neutropenia. And it can also produce the fatty deposition and fatty liver, which should be thoroughly monitored. And this drug can also produce few of the fatal hypersensitive reactions. In such case, this drug should be avoided. And with few of the other drugs like stavudine, it produces some antagonism. So this combination should be avoided. Similarly, this drug can also produce few of the drug interactions with the other drugs which produce the bone marrow depression and anemia, which are further increased by Azidothymidine. So that's about this Azidothymidine.
Very good.
Thank you, ma'am.